What new parents need to know about taking care of a newborn. Every new parent needs some help. Here's everything you need to know about your newborn, from sleeping to feeding and crying and pooping. You've no doubt been dreaming about your baby for months. What they'll look like, what they'll sound like, and even what they'll feel like. But chances are, you'll welcome tips for taking care of a newborn, especially if it's your first child. Well, take heart. Lots of parents have been there, struggling to know how to care for their baby in those exciting but often challenging first weeks. Read on to learn the basics of caring for your new baby in the early weeks of their life. 1. Visitors, family and friends will probably want to visit as soon as possible, but you may want to keep them at bay so that you can spend time alone as a new family. Since a newborn is usually alert and receptive immediately after birth, it's the perfect time to bond, so look them in the eyes and talk to them. They know your voice from being with you throughout pregnancy and may find it soothing. 2. Clothing. A cute going-home outfit may be irresistible, but remember that babies cannot regulate their body temperature until they're about 6 months old. So dress your newborn with care. Generally, they should wear the same amount of clothing as you, indoors or outdoors. Don't overbundle them. Sweating can cause them to become chilled. Instead, layers are a good way to go. 3. Feeding. No matter how you feed your baby, there are some things to remember. Follow our tips for breastfeeding and formula feeding in the early weeks. You can check our one-of video also on babies feeding practice. For that, stay tuned with us and subscribe our channel for regular updates. 4. Newborn sleep. Newborns don't come into the world with adult-friendly sleep habits. That's primarily because of their tiny tummies. Newborns generally need to eat between 8 to 12 times in 24 hours, including at night. So, don't expect a newborn to sleep for long stretches at first. However, there are some things you can do to make bedtime easier. You can check our one-of video also on baby sleeping care. For that, stay tuned with us and subscribe our channel for regular updates. 5. Newborn poop. Sometime in the first days after birth, your baby will pass a thick black or dark green substance called meconium. This is normal. Within a few days, a breastfed baby will begin having 6 to 8 bowel movements daily, which will be soft, yellow-green and sometimes filled with seed-like particles. If your baby is formula-fed, on the other hand, they will likely have 1 to 2 stools per day, which will be thicker and yellow or tan in color. Unless your baby has signs of diarrhea, wide variations in your baby's poop color, consistency, and frequency are normal. 6. Crying. Newborns can cry a lot. If you think about it, it makes sense because crying is their only way of communicating their needs. But it can take some detective work to figure out why they're crying. You can check our one-of video also on babies crying and its reasons. For that, stay tuned with us and subscribe our channel for regular updates. 7. Fevers. Fever can be a sign of serious illness, especially in a baby younger than 2 months. So, call a pediatrician if your newborn's rectal temperature hits 100.4 F, or 102 F if your baby is 2 months or older. Also, watch for other signs of illness. If your baby is acting oddly, not eating or drinking, or seems to be in pain, contact a healthcare provider regardless of their temperature. You can check our one-of video also on baby's fever topic. For that, stay tuned with us and subscribe our channel for regular updates. 8. Newborn bodies. A newborn baby's body isn't just smaller than yours, it also has some distinct characteristics. Knowing what to look out for can help ease your anxiety and enable you to keep your baby clean and comfy. 9. Genitals care. If your baby has a penis, you may notice that their testicles appear large. This swelling is due to maternal hormones. Don't worry, this swelling will go down within a few days. If your baby is circumcised, the tip of their penis will be tender as it heals. If your baby has a vulva, you may also notice swelling for the same reason as above. In addition, those same maternal hormones can also result in a bloody vaginal discharge in the early weeks. This discharge typically only lasts a few days. 10. Car safety. A few weeks before your due date, check out the proper guidelines and instructions on car safety and best ways to keep baby comfortable and safe in car. To ensure you install your chosen car seat properly, you can check our one-of video also on baby's car safety. For that, stay tuned with us and subscribe our channel for regular updates.